Hey, I'm Di McQueen, licensed clinical social worker, family and addiction expert. I'm here with Dr. Brian Jackson, my longtime cohort who specializes in the field of addiction. Welcome to Healing Families Shattered by Addiction.
Di and I have worked with addicts, alcoholics, and their families for over 30 years combined. Our podcast and coaching programs focus on families who have a loved one suffering from addiction. Our experience has been that this disease affects families as much, if not more, than the addict or alcoholic.
Is your world spinning out of control? Are you codependent? Are you experiencing worry, loss of sleep, and difficulty concentrating? If so, you're in the right place. Brian and I have both personally lived it, learned it, and now we're going to teach you tools and techniques on how to get your life back that you thought was shattered by addiction.
Okay, let's dive in.
Brian and I are so excited to introduce to you our new sponsor, Lakeview Health. They are a wonderful residential treatment center. Whether it's the family member who is looking for a place or the addict or alcoholic themselves, this would be the place that we would refer them to. Brian, you have many years of experience with Lakeview.
Yeah, Lakeview Health is a center of excellent addiction treatment. They take an evidence-based approach, medical approach to treating this complex brain disease. They hold the Joint Commission's Golden Seal, and they were voted one of America's best treatment centers by Newsweek magazine. They deliver dual diagnosis, gender-responsive, and trauma-informed care at their gorgeous facility here in Jacksonville, Florida. But they do see people from all over the world do come here to Jacksonville to go to treatment at Lakeview. Their levels of care include medically supervised detox, which a lot of people do need. Then they stabilize them in a residential rehabilitation and partial hospitalization program. They have board-certified physicians, master-level therapists, and they work to address the unique needs of each patient. So in other words, it's not a cookie-cutter program. They help individuals build skills for long-term sobriety. So if you or someone you know needs treatment, please visit their site at lakeviewhealth.com. We also have a hyperlink on our website at familyandaddictionexperts.com where you can just click and get some information about Lakeview Health. And Di, I think you have a number for people to call if they would like to inquire about treatment.
I sure do. That number is 888-480-3799. That's 888-480-3799. Give them a call.
Hi, everybody. This is Dr. Brian Jackson, and I'm here with my partner, Diane McQueen, who is a licensed clinical social worker, and she's also a master's level certified addiction professional. Hello, Di.
Hello, B. How are you?
I'm doing good.
Good to spend some time with you. We haven't done that in a little while.
I know. It's good to be on together. So this is our podcast, Healing Families Shattered by Addiction. And we thought we would today talk about the relationship between the individual loved one who has gone and gotten help, yay! And now they're coming home. Now they're coming home from recovery, and now the dynamics change and can be uncomfortable. But really wanted to speak to, since we don't a lot, to the person who's gone to rehab, is now reentering the family, and some of the things that they might be able to do to show an outward sign of an inward change that can put their family members at ease. And I think one of the biggest questions we hear, Di, is like, how do I regain my loved one's trust, now that I've gone to rehab and I've come home? So, regaining trust from family and friends after battling addiction is really a necessary part of the recovery process. And, it requires patience and a consistent effort in terms of reestablishing trust. So you want to mend those relationships after treatment. So once things start to stabilize and you're starting to think clearly in recovery, the top priority is regaining trust of your loved ones, of your family members. So it's important to make amends. That's sometimes not easy to do, but I think in rehab, you recognize some of the things that may have happened while you were under the influence, and maybe you've hurt some people. And I think it's time to clean up that part of the street, with your loved ones, and that happens by making amends. Um, so it's also important to make it commitments and promises and fulfilling them. For example, if you say you're going to be somewhere at some time, show up. If you say you're going to check in with the family because you're going out, check in. These are things that, based on experience, as opposed to what we're saying, what we're doing is what really builds trust with the family members. So you want to develop a routine that includes a relative, maybe go into a church meeting, could be another way to build trust. But it can take some time for the family to develop trust, but have faith that the process can and will work if you stick with what you're saying and doing what you're saying. So I don't know, Di,
Yeah, I think,
you
it's
want to jump
really,
in?
really, some of the tips that we kind of recommend for people, right? Which is, how do we how do we get that trust back? The addict and alcoholic often get like really frustrated with the family too, because they're like, look, I'm sober now, and why don't they just get it? And I'm like, no, 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 it doesn't really work that way. So we kind of understand, and we help them talk on both sides of this. Like number one and most important probably is keeping your word, right? So it's really important, but also from the family side of things, it's important that they keep their word. If you tell the alcoholic and addict something, and vice versa, that both sides of the aisle must be honest, and they need to help the other person understand that to be trustworthy and to be fail proof, and is to, if I say I'm going to do something, to do it, right? Not to go overextend on things that they can't do. So, for instance, I don't want you to come home from being in rehab and tell the family member, I'm going to go to a meeting every single day, if in my heart I don't think I can do that, right? Um, but I do expect that we are going to be true to, I'll go 3 times this week, and we're going to go ahead and be able to deal with that. Um, but you have to also remember that the emotional part for the family is that they're raw. Like there's a lot of things that were done that were hurtful, or maybe said that you don't remember, or maybe you stole money, maybe there was an arrest made. There's a lot of what ifs, but usually the family member is in a lot of pain. And so just because you've been in rehab for a month doesn't mean they've forgotten all the things that have happened, and there may have been a long history of these things. So in a month's time, even though the addict or alcoholic is feeling so much better, them keeping their word is going to be one of the cornerstones of how we rebuild trust within the family. And it's really important that we make the appointments we say we're going to do, that we go to the meetings we say we're going to do, that we make it to work on time, that we actually go back to work if that's something, that we go to see the people. If we say we're going to be home for dinner tonight, that we make sure we do that. And maybe it feels like it's a little bit over the top, but it's okay that it's a little over the top. We've done a lot of things to damage that relationship with the family. And so, and we're asking them for help, right? We're asking them to re-engage us in their lives, and we want their support. So to do that, it's really important for the addict and alcoholic to remember that the family has been hurt, that the relationship has been broken apart, and that to rebuild that, we need to take it a step by step, right? Do you agree, Bree?
Yeah, yeah. And you hit on something, and it's so interesting. I hear it time and time again. And families' emotions are very raw, and they're going to be watching their loved one that's returned from rehab. And, family members may say, are you okay? How are you doing? They might say, are you using? And, sometimes the person who has gone through rehab will take real offense to that and say, no, I'm not using. And they get into a sparring session. And my recommendation always is, I mean, if you've been using for decades and you went to rehab for a month and somebody asks you if you're okay or if you're using, you need to understand why they might feel that way. So I
Right.
always recommend to say, I understand how you can feel that way, mom, dad, family, but no, I am not using. And it's so important to understand that yes, you've made big changes. You feel so much better. But again, you've been living a different lifestyle for a long period of time. Some people, decades. And so now it's really important to follow through with your continuum of care to, again, give that outward sign of an inward change that you gave them by, instead of saying you're going to stop, that you actually went to rehab, completed rehab successfully. You've come out and now you're clean. Well, you've come out and now we're back where we used to use substances. And now we have to do a continuum of care to make sure that we stay in remission from our addiction. And the way to do that is staying connected with people who are healthy and in active recovery. And as Di mentioned, we can do that by going to 12-step meetings. Um, you may have made some friends at rehab. Hopefully, you got their phone numbers and stay in touch with them because they really are the people that understand where you've been, what you went through, and get some ideas and suggestions from them in terms of what they're doing to help them stay sober. So it's just so important, the communication. And I know communication got messed up while you were using and your family didn't know what to do. And, things were said and things were done that everybody has regrets about. But now this is about rebuilding and getting into a healthy family relationship um, because you all love each other. I mean, your family would have given up on you if they didn't love you. And so they're there and they they've been traumatized, by what's happened in the past, and there probably is some anxiety that it might happen again. So it's so important for the person coming out of recovery or out of rehab rather to recognize that, understand that, give them some grace, put yourself in their shoes, and get on with taking care of yourself. And much like when we're in addiction and it makes you sick and the whole family sick, the great news is you get into recovery, you're sober, the anxiety on your parents' face or your family's face fades away. They're not ruminating about it over time. I mean, all the time. But again, as Di said, you have to be patient. You have to take it one day at a time. And that is how, one day at a time, over a period of time, everybody is going to get back to where they have some peace of mind.
Right.
So,
Totally agree, B. I mean, it's really good points that you're making. And you mentioned something that's really key, right? With that leaving the lines of communication open, almost over communicating. I think you said it, communicate, 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 which is so true. And I know that it gets frustrating, especially for the addict, that sometimes, it's almost like, oh my God, I have to check in with these people. And it can be almost daunting, that we have to keep like telling them where we are and what we're doing. But as B just mentioned, we have done some really, at times, heinous things. They've been traumatized. They're worried all the time. So in the beginning, they don't trust that, oh, we say we're going to a friend's house, but are we? Oh, it used to be when we said we were going to the grocery store, that was code for I'm going to get a bottle of wine, right? And so they as soon as you say I'm going to the grocery store, their little, hairs on the back of their neck go flying up, right? Family members, we get nervous and start to get very concerned about like, are they? So in the beginning, it is difficult, but the way that we regain the trust is by possibly, what feels like over communication. It's really keeping those lines of communication open so we can stay connected with, our wives, our children, our parents, whatever it is that they need in the beginning to rebuild that trust. And in a lot of cases, remember that they're also being triggered, right? And yes, that doesn't mean that the family member doesn't have some work to do around that, but maybe they've been spending money over and over again, or they've been giving you a place to stay. They do have the right to ask where you are or what you're doing if you're living within the confines of their home. So there's some things that we have to do on a give and take to understand, right? Maybe sharing feelings about that is helpful, where, they can express to you on either side that there's fears involved, or that, they're, concerned about, oh my gosh, it seems like it took you 3 hours to get home from your meeting last night, and I was so worried. Um, could you just do me a favor and call or text me and let me know you were going out with the group for dinner afterwards? Because we didn't know that. So we started thinking the worst, right? Which is normal, even though it doesn't feel good to the addict or alcoholic. That why doesn't my family trust me yet? Why would they? Right? We have to show them that we are trustworthy. We have to prove to them that we are a different person today. We have to let them know. And they're not doing it intentionally. That's the other part of that, which is, family members honestly know that they're not doing this intentionally. It's usually out of fear, right? They're scared. They're not sure what to do. Family members, your job is to try your best to stay out of it, let them do what they need to do, ask once, maybe twice, and then step to the side and let them kind of bring it to you. If not, you need to pick up a phone and figure out what you need to do, who you need to talk to, an Al-Anon meeting, etc. So it's also important on either side that we get the help we need to help balance that out. But from the addict's perspective, really understanding that the trust must be rebuilt in a slow and methodical fashion by doing what we say we're going to do, how we're going to do it, when we say we're going to do it, keeping our word, keeping those lines of communication open, and trying not to get too frustrated with the family when they, in fact, are feeling more feelings around this. B, thoughts about
Yeah, I
that?
mean, yeah, for sure. Diane and I talk a lot about working with family members of the person, loved one that's in active addiction, but we also work with families once the person who went and got help is re-entering the family system. Um, and sometimes there's a lot of hurdles. So I think it's really important that family counseling can kind of identify, what may be dysfunctional in terms of the family dynamics. And some of that can trigger a relapse or hinder a healthy recovery. So this form of therapy provides the whole family with new communication tools to encourage, productive and healthy interactions and relationships. So I just want to get the message out there that, what we do is not exclusive to family members of somebody who has a family member in active addiction. We also and love to work with families once that loved one has been through some form of treatment and is re-entering the family unit, because it can be uncomfortable. It's almost like you're dancing differently. You've been sparring for so long, and now, how do we love each other? How do we communicate with each other? What do I do? What do I not do? It's not easy, but the good news is if we've got a sober loved one who's taken suggestions, completed a program successfully, they're more apt to be open to suggestions, and hopefully family members, now that you have the relief that your loved one has done something about it. Okay, we like this, but we're struggling with this and that. We can make some suggestions to you, and whether you do it with us or another counselor, it's very important to know that you have that option available to you, that we don't want to get stuck again, to where it could, lead to relapse or just unhealthy conversations and interactions with each other.
Beautiful. It's so true. And you brought it right into, you trailed right into my new lead here, B, which was, creating new healthy routines. And that is actually on both sides of the aisle, right? How do we rebuild trust? It is not just the addict that no longer takes care of themselves. When an addict is in active addiction, the people around them have forgotten everything, right? Like they're no longer working out, they're no longer eating right, they're worrying all the time, they're not sleeping. Just as the addict and alcoholic are out of their routines, most of the family members we know and see, whether it's in the beginning stages of active addiction, middle stages, the end, or in new recovery, we try our best to help both sides learn new healthy lifestyle choices, right? A fitness program, meeting routines. How are we eating? What time are we going to bed? How do we set that up so that we can get ourselves back into a healthy lifestyle? Going to counseling, of course, right, B? They got to come
Yeah,
see.
for sure.
and, get their coaching or group setting, whether it's an Al-Anon meeting, an AA meeting, an NA meeting, a group counseling session, which we also offer from time to time, where we're, 4 or 5 people, maybe 10 people, where everybody understands what the other people are going through. A new nutritious program, right? Some people have, just completely neglected their health. They haven't been to the doctor in as long as the addict or alcoholic hasn't been to a doctor, or a dentist or the eye doctor, or people that you go like, I haven't done any of these things that I quote unquote should be. And it does help to build trust with one another, right? Because maybe you go out and go, hey, maybe we'll go take a yoga class together. Maybe we'll go do a meditation group together. Maybe we go out to dinner on a regular basis. Every Wednesday night, let's have the family or a husband and wife get together, and this is going to be our night of having a new routine of it's date night. That's another big one, right? If it's a couple, maybe one night a week becomes your date night, and that becomes a new routine. Or a night where the whole family gets together and plays games at home. Lots and lots of new routine and healthy lifestyle choices that we can come up with, that are good for our physical, mental, and emotional and spiritual well-being. B, any thoughts as you?
Yeah, I mean, the evaluations that we do, Diane, it's an important point that you said, when we evaluate somebody who is ready to get some help, we always ask them, what are some of the things that you enjoy doing? And they may have a very long list. And then the next question is, well, what are you doing? I mean, it says you like surfing, you like working out in the gym, you like playing golf. Well, I'm not doing any of that. So the addiction has completely taken over their lives to where they've neglected things that used to be the source of joy and happiness for them. But
Right,
your point, Di, is important too, that I kind of, you know, not lost track of, but it's important that family members become so obsessed with a loved one who's addicted with worry and ruminating that they start to let up on some of the things that they enjoy doing because they almost get frozen in
right.
fear. And it really just, it's like a white tornado that takes over the whole family. So the flip side of that, as to your suggestion, now we don't have to worry about the addiction, right? It's not part of our lives. And now there's this huge void, this empty space that we can now fill with healthy things for every member of the family. And then if everybody's feeling better, you know, more power to the whole situation of of sobriety, healthy lifestyle, taking care of yourself, and not giving your life over to this illness, which is so powerful when it enters a family.
Totally
Right.
agree. Totally agree. And it's a wonderful way to rebuild trust within the family, right? The family members,
Absolutely,
or,
absolutely.
husband, wife, children, even if you're not living in the same house, there's a lot of times that this has been broken so badly that just having these moments, or even talking about your routine with a loved one is a really neat way to establish trust with them again. Like, it's like, wow, all these things are happening. But probably the most important thing after all those things we just discussed, and the one that most people don't really think about, is the patience it takes, with each other. And this is the most difficult one, I would say. Would you not be? I think being
Yeah,
patient
I
with
mean,
people.
we all like instant gratification, and it would be wonderful if 30 days in an inpatient treatment facility was going to solve all the issues that existed prior to. And so patience is not easy for anybody, but in this specific scenario, day by day, things will improve, and we can't have the expectation that things are going to change overnight and they're going to be perfect. There's some work that needs to be done, but it's not as time consuming as for the addict that was using and what it took to do that, and for the family members who were stuck ruminating, worrying, getting sick physically over this whole thing. So it takes a lot less time than it took to be a part of this hurricane of a disease.
Agreed. And the patience also, like, when I'm really patient with someone, right, I can give it the time and, the ability to let it sort of marinate on its own. And, that way I can probably establish forgiveness a lot easier, assess when I can trust, and, that it takes time. Like most of us, right? We don't go into most relationships, new jobs, new anything, right? Without giving it some time to rebuild the trust or establish trust. And we should do the same in this situation as well on both sides, right? The addict is also very uncomfortable with the family. And you have to remember that that it may take them a little time and patience to understand actually the depth and ramifications of the damage that's been done. But remember, we like to make sure that the addict is the only one to blame, right? And that's not true. Oftentimes the family member has been almost as bad, if not worse than the addict in their behaviors. And so it's really important that we understand that both sides need to be patient with one another, that we need to assess the level at a pace that makes some sense, that forgiveness comes naturally if we start to rebuild those lines of communication, when we can really say, we will see that we feel more comfortable. We've set boundaries with one another that are reasonable now. We have new bonds that are probably stronger than ever because we now have tools in our toolbox to actually get real with one another. We've hopefully established an open and honest communication that we probably never did in the past, because everyone was doing things to try to step on eggshells around what was going on or pretend it wasn't happening. One
And
of the two. The
the
secrets, the
secrets.
lies, the anger, the whatever. So this changes everything, but it does take patience and understanding and time. So I think that those are the really important things to establish as we begin to, reformulate the level of trust within a addict family back and forth relationship, and remembering that it's on both sides of the aisle. It is not one and or the other, it is both. It's really important that everybody remembers that they all played a part, and it takes all parties working together to reformulate that trust in a healthy manner. But
Yeah, and a lot of things that you said, Di, like family members may have, played a big part in this or said or done some things that were as egregious, maybe as the person who was under the influence and acted out. But a lot of times it's outside of your awareness. It wasn't intentional, in
correct.
terms of the way you reacted. It was just the frustration, like, well, I tried this didn't work. I tried that didn't work. Maybe if I start screaming, that will work, or threatening, or, even fighting. Um, but the good news that we want to get out to everybody, and particularly on this podcast, is that family members do go and get help, and they do come back and they do enter the family. And the goal now is for everybody to get healthier. Are we going to get perfect? No, but we want to try and stay away from those old coping mechanisms that, the muscle memory will take us back to that. We've got to catch ourselves. And that's why I think it's so important, for the whole family to be involved. And a lot of times that requires some family counseling rather, with people who understand it and see it. And Di and I wouldn't have any skin in the game if we were working with you. We would be able to give you objectively some suggestions that could make the re-entry into the family more comfortable for everybody. So
Exactly. So yeah.
yeah, yeah, Di, I think this is a great topic. Hopefully,
Yeah.
this is a good takeaway from not only the person who has gotten into recovery, the family member, but family members as well, because we want that family unit to be restored. It's not that it's going to be perfect. I don't think any family is perfect, but we want to have a healthy family without the substances. And
Exactly.
that,
So just to recap for everybody, because I think it's a real simple process, right? That we talked about a lot of things, but basically what Brian and I were saying is that there's trust that needs to come back together, right? And the way to do that is by starting with some very simple techniques: keeping your word, keeping those lines of communication open and available for each other, being honest and true to one another, setting up new and healthy routines, that, maybe both sides haven't done in a very long time. And above all, and most importantly, not only being honest, but being patient and having understanding with one another. That is what's going to bring you back to a nice, healthy relationship, as well as some good counseling with some experienced, coaches, counselors, whatever, on both sides of the aisle that will help bring the whole family together and have some understanding of the addiction process. Thanks so much for joining our podcast, Healing Families Shattered by Addiction. We'll be back in a couple of weeks with more important tools, techniques, and ways for you to focus on you instead of the alcoholic or addict in your world.
Until then, please go to our website, familyandaddictionexperts.com. That's familyandaddictionexperts.com. You'll also see links to our Facebook and Instagram pages. Please also, if you have any emails that you would like to send us, that's info@familyandaddictionexperts.com. That's info@familyandaddictionexperts.com. With any thoughts, feelings, questions that you may have for us, we would love to hear from you, and we look forward to seeing you in a couple of weeks.